I swear, Hillary, I believe they watched Saturday Night Live last night. Who would have thought that Saturday Night Live would be the ones that get it right? I also want to say that I've taken notice of the fact that you've been spending a lot of time with my husband. And I also have noticed that since you announced for the race, he has not even looked at anybody else. You were the one from the beginning, and that's who he was. And I think it's kind of interesting that the two most important men in my life have been the same way. My 91-year-old dad shocked me one night when he said, I believe that she's the one that ought to be the next president. Now, I'd heard John Glenn say that, and I knew he had worked with you, and he knew what he was talking about. But I looked at my farmer dad, who spends all of his time on a tractor or on a combine or milking cows, and I thought, how do you know and feel so strongly about this? But he is a guy, I mean, I'd like to get philosophical and say, well, as a farmer, he watches things grow, and he has a strong sense of timing, and that he knows that this woman has grown into this job, and the timing is right. And I'm going to give you a message that I think that this Kentucky farmer would like for me to pass on to you, and that is, you go, girl. But I also want to tell you that while you've been spending time with Ted, because he knows that he wants you to be the president that he works with as governor of this great state, I've been kind of looking at someone else, kind of a guy that I would like to help me with being First Lady of Ohio. And I got to spend a day with him. And I want to tell you, he was very inspiring. And one of the things that I heard someone say as we were leaving was that when you hear him speak, you feel like you've learned something. Right. He's a great educator. Oh, yeah. Right. We were standing it was like 10 o'clock one night, and we had, he'd had a full day in Texas, and he spent a little time with, quite a bit of time in Ohio, and it was 10 o'clock at night. And I looked at him and I thought, this man has got to be worn out, so I extended him a little sympathy. And I said, are you ready for this next big push? And I expected him to say, you know, campaigns are really grueling, and you kind of forget about that, don't you? But instead, he had this really determined, resolved look, and he said, more than ready. I can tell you that Ohio is more than ready for Hillary Clinton as our next president. And I can tell you that Hillary Clinton is more than ready to be President of the United States. I give you the next president, Hillary Clinton.
Oh, Ohio, you are so lucky to have Francis Strickland working on your behalf. Some of you know that Frances is an educational psychologist as well as your First Lady, and she has devoted her life and her professional career to helping our children and to really giving our children the chances each should have to live up to their God-given potential. I am so proud and so grateful to have Frances and Ted Strickland supporting me. Thank you so much. To mention here, I was told that I was going to run by and thank some of my canvassers, and I had no idea I would walk in and see this packed gymnasium, and We love you. The last day for some people, this election is, it's about how you feel. It's about speeches. Well, that's not what it's about for me. It is about Southern Ohio. I was visiting a couple of families and they told me this story about a young woman who worked at the local pizza parlor. She got pregnant. She was going to be a single mom. She made minimum wage. Started having problems. There's no hospital in Meigs County anymore, so she went over to the next county. Hospital told her she had to come up with $100 before they could see her. She said, I don't have $100. They sent her home. She still had problems, went back later, same response. Need that $100. And I don't blame the hospital. Hospital can't just give the care away. You don't have a universal health care system and everybody doesn't have it. If they do give the care, then the rest of us pay for it, and pretty soon that means your insurance premiums go up and more employers drop you, and then we're just back into this vicious downward cycle. Well, to make a sad story short, she went into premature labor, got rushed to the hospital. It was too late, the baby died. Then they airlifted her here to Columbus, where the good people at the medical center here just worked as hard as they could to try to save her life for 15 days, and she died. So I want you to think about this. From a moral perspective, that was wrong. From an economic and taxpayer perspective, hundreds of thousands of dollars were spent to save that baby and to save that young woman because she didn't have $100 to get the care she needed. We cannot go on like this. This is morally wrong and it is economically stupid. We have to have universal health care that includes quality, affordable health care for every American. And this is one of the big differences between me and my opponent, because I know we can do this now, because businesses, labor, doctors, nurses, and I'm so proud to have the American Nurses Association endorsement. Thank you all very much. They know that they're at the mercy of the health insurance industry, and so are all of us. It's unconstitutional to discriminate against people on the basis of race and gender and religion and ethnic origin, and thank goodness it is. But it's okay for the health insurance industry to discriminate against sick people? That makes no sense to me. So we're going to tell the health insurance industry, you are no longer going to be able to make life or death determinations. You're going to insure everybody and insure their pre-existing conditions and give us a chance to get the health care that everyone deserves. We're not going to leave anybody out. And we're also going, once and for all, to make it clear that our workers can compete with anybody. That's why we're going to have trade agreements. Turn our country around, get back on the right track.